Hello, my name is Zacchaeus Chimedza. I'm a nursing student at West Coast University, Dallas campus. Today, I'm excited to share with you some interesting information that I found from the International Journal of Nursing Practice. I'll be sharing a journal article entitled The Work Environment of Hemodialysis Nurses and Its Impact on Patients' Outcomes. I'll start with the introduction and purpose of the research study. This study was conducted to assess hemodialysis nurses' work environment and examine the correlation between work environment and patients' outcomes. Additionally, the study examined adverse patients' events that can occur during hemodialysis. As you all know, these can include medication errors, hypotension, hypoglycemia, catheter-associated infections, and venous needle dislodgements. In this article, the purpose of the study and its relevance to the nursing practice was clearly explained. Per researchers, hemodialysis units and nurses were the subject of the study because although numerous studies have already examined hemodialysis nurse work environment, very few have investigated the correlation between the environment and the selected patient's outcomes. In this study, researchers investigated the hypothesis concerning the correlation between the work environment and the selected patient's outcomes. So why is this study important to epidemiology and nursing practice? Per researchers, nursing shortage has been posing a threat to the healthcare system worldwide. Hospital staffing levels and adequate resource availability are issues of vital importance for nurses' physical well-being, mental health, and patient safety. This research study was conducted from June 1st to July 31st, 2012. 133 completed questionnaires were returned out of the 149 that were sent out. Some of the results include the findings in this study indicate that dialysis nurses work in a non-favorable environment. Per researchers, these findings are consistent with the findings of Thomas Hawkins and colleagues. The fact that a similar study resulted in similar findings provide evidence of reliability and validity of research. The results in this study shows that workplace characteristics such as staffing and resource and nurse participation in hospital affairs were scored low by the respondents. An instrument known as multivariate logistic regression analysis identified that hypotension and venous needle disconnection were frequently reported and were associated with non-favorable work environment. These findings indicate a correlation between work environment and the impact on patient outcome. Now I'm going to discuss some of the article's strengths and limitations. So several limitations were identified in this study, and these include the study had a relatively small sample size, n equals 133, and the nature of reporting adverse events was rather subjective than objective. The presence and frequency of hemodialysis adverse events were studied through the dialysis nurses report. However, direct observation of nursing care would have provided more objective data. Additionally, researchers stated that given that we conducted a cross-sectional study and the self-reported nature of the study, we could not know if the effects are caused by the negative environment or if the environment was negatively rated because of adverse effects occurring. The strength of the study was also identified. Researchers' objectives were attained, and they included sufficient data on how the study was conducted and accomplished. Ethical considerations were also taken into consideration. Validity and reliability of instruments was also considered. Per researchers, Cronenberg's A for the subscales in the present study ranged 0.6 to 0.80, and for the overall PES NWI was 0.86, indicating acceptable reliability. In this study, researchers provided an overview of the available literature in nursing practice as it pertained to the objectives of nurse work environment and hemodialysis adverse events. The study consisted of a detailed review of literature. However, limitation was noted in the number of in-text citations. Reference citations appeared correct with APA-style formatting. In conclusion, and my opinion piece, I chose this article because of my previous work experience. I recently worked as a nurse care technician in a unit that experiences a huge turnover rate for both nurses and technicians. I was curious to learn the relationship between work environment and patient safety, so obviously this article caught my attention. In this article, it was interesting and unfortunate to learn that although nurses are the largest professional group in the healthcare organizations and provide 95% of the care patients receive while hospitalized, their participation in hospital affairs is not equivalent to their contribution to frontline healthcare provision. After reading this article, I feel as if nurses can be treated better and should be given opportunities to be involved in decision-making and policy issues. Per researchers, if healthcare organization administrators and managers wish to ensure the provision of safe and quality health services through satisfied and effective nursing staff, they should focus on and improve the conditions under which nurses work. I found this article not only interesting, but both informative and clearly written. Thank you so much for listening.